Thank you for coming, thank you for choosing, thank you for finding us. We did a good bilateral two-sided varicocele surgery for you. It's really, I'm very happy with the results now. There is no residual vein. Sometimes there are some residual veins left behind, they will disappear by time, but in your case it is now all clear. I want you to comment on what's the difficulty of coming here. Is it possible? How you choose it? You are coming from New York, right?
Correct.
From United States. Yeah, how was it? How did you find us? What's your comments?
Well, I had the varicocele around 2 years ago, and then I had it till like 2 months ago, a lot of pain on my right side. And I was Googling, and it said right side varicocele is not natural.
Yeah.
Typically sports is left side, and I am very active, I run. And then from there I was looking on Google, YouTube. I saw there was a doctor in New York, but the problem with the United States is the cost of the surgery.
Yes.
Well, the doctor that I was looking into, he was like 10,000, 12,000.
Yeah, 10,000. Usually around 10,000.
Yeah, around that. But then I found you, and then watching your videos, the way how your testimonials, my big concern was the pain.
Yeah.
So that's why I was like, let me reach out to him. To answer your question about the most difficult thing about the trip, it was just making the decision. The most difficult part of this whole thing was making the decision, right? Yeah, because not a lot of people are informed about your procedure. And I feel like I even commented on YouTube for a doctor in the United States, and I asked him, what about removing the vein? And he said, completely avoid.
Yeah.
And I said, well, come on.
Actually, he has no idea because there is no one doing it.
Right.
This is just, I understand after my experiences that it is not enough just to ligate. It really needs some intervention, some improvement in the technique.
Right.
Then I begin to do it. There are some of my friends, two friends are doing this way. Other world, the rest of the world do not have any idea about it.
Right.
So
it's just ligation, and then leave it there to heal by itself.
yeah, we are educated like that.
Yeah.
We said ligate it, and the blood flow will stop, and there will be coagulation of the vessel first, then it will disappear.
Right.
So I was doing it like that, but then when I begin to use Doppler ultrasonography, my patients come, I look to you before the operation and see the vessels, and after the operation I look again and see now there is nothing. But previously, when I was doing normal procedure, the patient asked me, doctor, please look again, how is it inside? When I look, I said, now ligate this part, there will be a little more swelling, of course, the vein is now, the flow is stopped, but there will be no flow. It is stopped, and coagulations, we will see the coagulations.
Right.
When I look, oops, it's moving, it's flowing.
Yeah.
I couldn't believe in my eyes. I was shocked. The patient said, what's that, doctor? There's still flow?
Yeah.
Maybe we are in the wrong side, maybe in the upper part, maybe no, we are in the testicular side, and there is still flow. I couldn't understand. I said, please come 1 month later. He came, the vein is still there, the flowing is there. No urologist is aware of this because they don't use Doppler ultrasonography device. They send patients to radiology department for this. I don't know why, by chance, by fate, I had this device, and I begin to do it myself. So I noticed that there is a big problem. There is no stopping of the blood.
Right.
So that made me change everything, and I understand the mechanism. There are some little, very tiny channels that the blood flow continues, and this vein is not enlarging. This is still tiny, but it makes the continuation of the blood flow, and the remaining part remains forever. Not in all patients. 70% of the patients heal 100% in non-conventional procedure.
Right.
Because people are, when they listen to me, they are very scared. Hey, I had normal procedure, please, did I, no, 70% heals. But 30% recurrence is too much.
Yeah, that's the thing, and that's the reason why I was looking to see if I can find someone with a better procedure. I was looking because my parents are from South America. Looking at South America, the country of origin that my parents are from, they've never heard of varicocele.
Really?
Yeah. And I was like,
they are lucky. If you marry early, if you at 25, if you do the child,
I think that's
there is no problem with the varicocele.
Yeah.
Nobody will care of it. So like that's why previously in Turkey, nobody knows what's varicocele.
Yeah. So that's why I was looking because trying to see cheaper options because that's a big thing. But again, as I said, the most difficult, well, for me, of course, depending on the situation, economic situation.
I'm trying to keep the cost as low as possible. I know this is a unique procedure. Only I do it this way, and I can really ask for higher prices, but it's enough. We are not the richest country. I am not the richest man in the world, so I want to keep it simple to reach more people. Or not everybody is coming from states. There are poorer countries, moderate countries. They are. It's very difficult for these guys to come. Actually, you choose the expensive hospital. There's a cheaper option, but it is of course better if you can choose the.
But that's the thing. Even if I chose the expensive, and I didn't consciously think that I was going to choose that, compared to the price in the States, it's a huge difference.
Yeah, I'm always thinking about the flight prices cost and hotel cost. Because it may be doubling the price, right?
Yes.
And you traveled with your mom, so it looks like your sister.
Thank you.
Yeah, really. Then so it doubles, maybe a little more than double, but still, Istanbul is a good place for travel, sightseeing, such.
And I would recommend coming with someone because the first few days you don't want to overexert yourself, but you don't want to bend down to tie your shoelaces and stuff. So I would recommend, but if you plan ahead, you can keep it around 6,000-7,000.
Yeah. So if the guy has a problem with the cost, can he come alone?
Yeah. I mean, if that's an issue, I think alone it could be with the surgery at a cheaper hospital. Probably 4,000, 5,000.
Yeah, I think so. Yeah, and in Europe the flights are cheaper from the Europe and the neighboring countries. So I think the least price they can afford 4,000, maybe for whole hotel, flight, everything. But from States, a long distance, when you have a company, it's good to spare 7,000, maybe 6,000.
Around. They really check out the price.
So when we calculate like this, so the price of the operation nearly 35% of the total cost. I want to keep it that way. I will try my best to do it that way because I want to be reachable. So this is good. And now we are in the third day after the procedure.
Yes.
And how do you feel today?
No pain. The day of surgery, I felt the difference already especially my right side. That's the one that I had the pain. I felt like pulling. But no pain. I have surgical pain. I feel like it's my first.
The older pain gone.
It's gone. It's gone. The pain from before is gone. I have this surgical pain, which is on the incisions.
Yes.
I feel, and because it's my first surgery, I'm a little afraid to move around and stuff. But in terms of me sitting down, sometimes I would sit down and I'd be going like this and stuff like that. I don't do that anymore. So you can feel the effects.
When I begin to take look, this is one pain. So normally we ligate it here and leave this pain to disappear. But now I am taking it out. I begin to do this. The patients say, really, hey, this pain has gone. I don't feel it anymore. Okay, that's scar tissue pain. Because when we ligate and leave it behind, after the procedure, they said, oh, I have still the same pain. We were saying, okay, be patient, this will disappear by time, and the pain will go by time. I think that actually the success rate is 70% in conventional procedure. But doctor says for pain it is 50%. Actually, this is not true. If they wait 1 year, because it takes 1 year for sometimes to this way to disappear. After 1 year, pain goes. In these conventional procedures, I think it's still 70% for pain too. But it will take for this pain to disappear 1 year, so the patient suffers from pain 1 year, and doctors say, oh, this is unsuccessful. But if he waits enough, it will disappear 70%.
Yeah.
But still, I am very happy because when I take this out, next day patient says, oh, it has gone.
Yeah.
This is not the same pain.
Like I said, pain in the testicles and the lower abdomen pain.
Yeah.
Gone. Because I used to have pain on the sides.
Yeah.
Like someone was pitching.
Yes.
And
yes.
that's gone. I only have, like I said, pain in the incision. Even that, I think the second day yesterday, I was able to walk a lot more.
Yeah, second day you can, and now it is third day.
Third day.
Third day, and will you fly on Sunday?
Monday.
Monday. Okay, it's safe.
Yeah.
It's safe. Now I think you will feel a lot better. Unfortunately, we have a little large airport. You have to walk too much in the airport,
Yeah.
but you will. Don't worry. So you can do a little sightseeing to maybe Sunday or tomorrow with cab. Take a cab.
Of course.
Go to some restaurant and because Istanbul is a good place for sightseeing too.
Of course.
When you come here, just do some sightseeing. But it's very crowded. Select some places. Ask the hotel to recommend you some places. Easy to go, easy to visit such places.
One thing though, I would say is if you're coming like Americans, it's the time change. It affects the sleeping pattern because like
jet lag, we call it.
jet like when I got the anesthesia, I was out. I was out, and it took me a minute to like.
Yeah. When you are going back, that it will not happen.
Okay.
When we go from Turkey to America, nothing happens.
Yeah.
But when we come from US to Turkey, for 4 days, 5 days, you are sleeping all the time.
Last night I didn't sleep. Like I slept at like 5 in the morning.
Yeah. Unfortunately, yes. Yeah.
So,
the travel to East is like this. It's also an issue.
Yeah. I mean, it's doable, but my priority was getting rid of the pain and success.
Yeah. Thank you. And there is a new issue. We have to cover it quickly, like this prostate inflammation issue.
Okay.
There are two main reasons for testicular pain.
Mm-hmm.
One is varicocele, one is prostatitis.
Mm-hmm.
So when people come to me with and we detect no varicocele, there is no varicocele, we say, oh, it is prostate inflammation, prostatitis, we treat this one.
Right.
When patient come to me, when we examine, there is varicocele, I am not sure if it is 100% because of varicocele or there is some additional prostatitis. We can never know this. So I don't want to take any because my experience previously, I operated some of them. They healed completely. Then maybe 3 months later, some of the pain come back.
Mm-hmm.
So because there was some additional prostatitis. Mm-hmm. So nowadays I am doing prostate examination during the operation because when you are under anesthesia, when you are sleeping, it's easy. Yeah. If you do it when you are awakened, it's painful. And it's distressful, so discomfortable. So when I do it to everyone and try to identify if there is additional prostatitis or not, very surprisingly, I see very commonly prostatic inflammation, secretions coming out in these patients. Is it because of do they really have prostatitis? Or is it the secretion is coming out because you are under anesthesia, everything relaxed? This is a normal secretion of the prostate. Right. I'm not sure. Yeah. How we will understand? We will understand by this way. If you are very well for 3 months, then after 3 months, there are some alerts, some signals. There is some awareness in the testicles. You have to remember, oh, this may be refilling of the prostate. Okay. So you say you will come back 6 months later. Yes. So it's easy for us. We will examine you again and we will understand if there is anything. Okay. But I recommend people, if they have some kind of awareness, pain, something is coming back after 3 months. Yes. Because I drained everybody's prostate nowadays. Yes. So after 3 months, if they have such issues, I would recommend them to make a research on prostatitis first to understand what I did, what's the treatment options of my treatment options and the Western medicine, because there is a little different in prostatitis treatment. In Russian medicine, it's a different type. I use it. Okay. It gives real solution. In Western, it is not treatable. They say it is chronic prostatitis. There is not much thing to do, but it is curable.
Why do you think they don't? Why do you think in America they don't?
It's not very common. In Russia, it's very common. So they have to find a solution. But in other countries, like varicocele disease, and normal urology doctors operates 2 varicocele a month. If there is a problem in one of them, it's not a problem. He never is aware from it. He never understands. So he doesn't care too much. But I operate 20-25 cases in a month. Half of them is having problem. This is a problem for me.
Yeah.
In Russia, everybody's chronic prostatitis. Yeah. I don't want to insult all my Russian friends. I learned all of this treatment from them.
Okay.
I really respect. I wish peace to Russians and Ukrainians nowadays. They are both friends.
Yes.
So they have a lot of this problem, and they know how to cure it. In Western, it's not very common.
Okay.
But the man who is having this, they are really in trouble. They are really depressed, and it's a very big problem for the ones who have this disease in Western Europe. Okay, so in your case, there was a fluid coming out. It was really a little abundant.
Okay.
Is it because of a real prostatitis, or just because you are sleeping, we take out the normal prostate secretion?
Okay.
Both is possible.
Okay.
The way to understand, if you have nothing, no pain, no issue, nothing, so that's nothing. But if you have pain in 3 months later, so you will come back again, we will see it again, we will treat the residual part. Thank you for coming, thank you for your explanations. Really, we need this, and people, because they hesitate.
That's the thing, and I feel like that's a huge thing. Like varicocele is not, it's not dangerous, not life-threatening.
Yeah.
But it's life-changing,
Yeah.
and it does change the quality of life. I'm a young guy. I'm assuming there's other young guys. There's an app called Reddit, and they have a chain where like they speak of varicocele, 18-year-olds, 16-year-old guys, and to change your life that early on just because of something that can get fixed and easily, it's kind of sad. So.
And really, it's very easy to perform the surgery at primary case. The first case is easy. Unfortunately, half of my practice is secondary cases, recurrent cases.
Yeah.
It's more difficult. Success rates a little lower. So everybody has to deal more with this issue. Yeah. Thank you for explanations. Thank you for coming. It's really an honor for us meeting you here. Thank you, Sandra.
Thank you.